Good morning, everyone who's joining us for our dental chat by Alluro. We're here this morning. I can't recall if we've done one this morning. It's normally very late at night, and I was just telling Malena that I much prefer to do it this morning because I'm a morning person. But anyway, happy Friday, and here we are for another dental chat where we're providing education, information, and new products as well in a more informal way. We record this live. This goes straight to our website in our education hub that we have there, and it's a few other dental chats that we've done through the years with another partners with us. But this morning we're going to talk about a great little product that has been very popular in the last couple of weeks, but it's been popular for the last 20 years. From a company called Addent in the US, and the product is called Calset. And we have Malena, who is going to talk to us about the range of Calset and how this should be a critical tool for your day-to-day in practice, right? Especially on those cold winters that we don't get as cold as Colorado or New York, but the South Island gets snow, obviously, and frost. So anyway, good afternoon for you, Malena, and also Josh is joining us from Addent. You can take it over now from here, and thank you to be here. Later on, just for about 20 minutes, half an hour, Dr. Jason Smithson from the UK is going to join us as well in the chat. So just keep on here. There you go.
Thank you, Rudy. I appreciate it so much. I would like to share a PowerPoint presentation. Let me go ahead and do that. Okay, can you see it? I think.
Yes, yes, we can. You just need to go into the presentation mode.
There we go. Okay.
Perfect. Thank you.
You're welcome. So yes, my name is Malena Pereyra, and I work for Addent Incorporated, a dental manufacturing company located in the US. We have been in business for 23 years, and the founder of our company is here with us, Dr. Joshua Freeman. He's an engineer as well as a dentist. And we will be joined later on with our special host, Dr. Jason Smithson from the UK. So the Calset is a heating device with several tray configurations to fit the doctor's everyday needs. There are over 60 studies on our website that talk about the benefits of warming composites. It increases the depth cure, makes composite easier to extrude and better to adapt to the cavity walls. It improves composite flow by 68% and it shortens the curing time by over 50%. It reduces the micro leakage and stress. It improves the physical properties of the composite. It heats composite instruments for an improved marginal adaptation. We use composites instead of flowables as a base liner, and it features 3 temperature settings, so the 37, 54, and 68 Celsius. So some of the common things that we come about is that I'm getting the same viscosity as using a flowable. Heat accelerates the polymerisation, so a heated composite has a faster cure rate, making the polymerization harder. Flowables have lower filler percentage, which creates a weaker layer of restoration. We recommend to warm the composites all at 68 Celsius. The result with a flowable is comparable. A warm composite is more pliable, giving more flexibility to create an ideal restoration Plus, once the composite is cured, you will get less micro leakage and a stronger result. Finding it backed up by multiple studies by leading universities. I don't want to waste composite if I'm not using it all right away. This is a pretty common question. Dentists don't want to waste their composite, and it's not a problem because with the calcet, you can warm the composite, you can cool it, you can warm it, and there's no changing on the properties of the composite. And I don't want to wait for the compule to be warmed up. This is not a problem either, because when you come in first thing in the morning, all you have to do is turn on the calcet. It takes about 15 to 20 minutes to warm up. And then every time that you put a new compule, it takes 3 minutes to warm up. This will allow you to save time when it comes to the curing. Below, I listed our website with research articles by leading universities that you can later on check out. Now we're going to go over our tray and calcet options. So we have the Calset Multi-Pro, which is a flexible tray, and you can warm dispensers as well as syringes, or a combination of both, 2 finishing instruments, and 4 compules. I have one right here, I don't know if you can see it. But this is where you put the finishing instruments, and it has 3 orifices where you can fit your dispenser, and then the 4 compules. And this is our heater base. All you have to do is place the tray on top and then turn it on first thing in the morning. Next, we have the Calset with the standard tray, and it allows you to warm 8 compules, and it has a lid so you can cover it up. We have also the Calset with restoration tray, which allows you to warm up inlays, onlays into compules. We also have the Calset anesthetic tray. This tray, you will have to change the temperature setting to 37 Celsius. And we have studies on our website that when a patient is injected with a body temperature anesthesia, it's more comfortable for the patient. So this will allow you to do that. We also have the Calset 7-hole syringe tray, which allows you to place 3 large syringes and 4 small syringes. We have the Calset with a veneer tray, and this tray is neat because you can place your veneers with composite, cover it up, wait 2 minutes, take the cover off, and place the veneers on the patient's mouth. The material will expand and it will be easier to clean up. And last but not least, we have the Calset dispenser tray, which allows you to place your dispenser of choice and the compules at the bottom. So an overview of the Calset is that the Calset is a heating device that will allow you to warm up composite material, local anesthesia, porcelain veneers, syringes, the dispenser of your choice. Yeah, and then listed there are a few features and benefits. Just to go over it, the Calset has 3 temperature settings. It provides you with constant temperature. It increases the degree of cure. It warms finishing instruments. And the benefits are that it shortens the curing time over 80%. It improves the composite flow by 68%. It reduces the micro leakage and improves the physical properties. It decreases the shrinkage stress. So, why wait? Just invest in your patient's health today show them that you care, and enhance your practice. I would like to thank you for listening to us. And our special guest will be joining us today, Dr. Jason Smithson. And Allura, thank you so much for the time. Now, Josh, would you like to take over and tell us a little bit about the concept?
I can always say a few more words, but maybe before I do, I will ask if there's any questions and answer them first.
Okay.
And I'd be happy to do that. So are there any questions about heating composites or the Calset, or using it as a cement instead of a cement, and using the composite as a cement? Any questions along those lines?
I do have questions, George, but I didn't have questions about using as a cement. So why don't you just tell us about that?
Okay, well, there's been studies, one particular one by Pascal Magny, who's pretty much a world famous key opinion leader. They've done studies which show that if you use a warmed composite rather than a luting cement, there's two advantages. First of all, if you have a microscopic marginal opening in your restoration, that opening becomes a restoration, not a cement line, which could eventually wear out. But the more important reason is it actually will seat deeper. That they've shown that the actual warm composite seats deeper onto the prepared restoration better than a luting cement. So those are two advantages of using it. And then the third advantage would be in the case of veneers, where if you're placing a veneer and you're comparing the use of a luting cement versus a composite, what happens is that when you use a veneer, the excess of material extrudes from around the margins of the restoration, and it makes cleanup difficult. When you use a heated composite, the extruded composite material that extrudes around the margin cools very quickly, and it's easy to clean off with an explorer and then do the final cure. I should just back up for a minute. You would do a tack cure first, and then you would remove the excess, and then of course the whole procedure would go much faster. And so those are those applications where you're using the heated composite instead of the luting cement.
Gotcha. I'm just going to put a picture of what we're talking about. So, right. Thank you, Josh. So my questions are about just mentioned before to Malena before we start this. I was just saying that the most common combination that we provide here in New Zealand is people buy a composite heater, like a Calset with the compules or a Calset with the syringes, or in this case, a new Multipro. You buy that, and then you buy the tray for the local anesthetic. Now, I understand that you get into the office in the morning and you switch them on, and it takes some time to warm up, right? To get to
minutes, but then it stays on all day.
Right.
And in fact, it turns itself off after 10 hours if you forget to turn it off.
Oh, good to know that. Right. So turn it on, boom, gone. You have your local anesthetic first, obviously. So my first question is if you have it on the green, amber, or red settings, it doesn't matter if it's local anesthetic or if it's a composite, or you need to have a local anesthetic on a lower.
The machine, the Calset heater doesn't know which tray it's being placed on. But obviously, if you're going to heat local anesthesia, you want to do it at the lowest temperature, which is the green setting, which is body temperature. So that's the first thing. You wouldn't ever want to heat local anesthetic to the high temperature of 68 degrees, so that would be kind of obvious.
Okay.
The other thing I wanted to point out was right in the middle of that picture, you're showing what's called the
restoration.
Yeah, the restoration tray. And that can be used in two ways. We showed earlier the veneer tray for the veneers. Well, this is a tray that could be used for veneers, but also for, if you see, cementing of onlays and inlays, because it's deeper. So it allows you to heat those types of restorations a little bit better than in the veneer tray, which is designed specifically just for veneers.
Okay. Just going back to the temperature. So we advise to get into the green, which is the body temperature. From there, you do the couple of clicks, to the red to get your composite there. How long will it take between the green and the red, and also to the compules to get?
That's a good question. It's very short. It might take 30 seconds or something like that.
Okay.
40 seconds. I'm not sure, but it's not long at all.
And you will know also when the temperature is reached, because you have a solid line and then you have a blinking light. So once that blinking light stops, then you know that you have reached the temperature that you set it up.
That's exactly right. It tells you when it reaches that temperature.
And the composite himself, it doesn't take long, right? It's just a minute or
3 minutes.
3 minutes. The composite. So
I want to mention something about the difference between the tray on the left and the multi-tray. The tray on the left, the very first tray that we came out with, it was designed to heat compules. You can also express some composite from a syringe in the center and pick it up. The problem with doing that is that there have been many studies that show that the temperature will drop quite a bit by the time you actually place that in the tooth. The next best thing is to have the compule inside of the dispenser gun and then bring it to the tooth. And that brings the temperature of the material closer to the numbers that you want to have to get the advantages of a heated composite.
Good. I have another question about the veneers and the onlays. I'm obviously not a dentist, so forgive me for this question, but why would you like to heat the veneers or the onlays or the inlays?
Say that question again.
Why would you like to heat the veneers and the onlays?
Okay. Well, as I said earlier, two reasons. One, the composite gives you a stronger bond than luting cement. Secondarily, if you look at the margins under a microscope, and the margin is not absolutely perfect, I'm talking about high magnification, there's a little space between the veneer and the tooth. That gets taken up by a composite, which becomes a restoration. It's not going to wash out. It's much stronger than the luting cement. The luting cement has a low filler loading, and it's not as strong. And so that's one advantage. The second advantage is it's just stronger. And the third advantage is, as I mentioned before, when you use the composite that's heated, after you press it onto the facial surface, the material extrudes from all around the margins of the restoration, but it cools very quickly and you can clean it. That doesn't happen when you use room temperature luting cement. It just runs all over the place. And then you have to clean it somehow, and it's not that easy. This way, when you place it on the tooth, you do a tack cure, the material that's extruded is heavy because it's heavy body material. It's easy to clean. So that saves a lot of time. And dentists that know it appreciate that procedure very much.
Done. Now it's clear to me. I'm sure it was clear for the clinicians before, but thank you for that. Now, the other question I had about this is we did have once upon a time somebody who put them on the autoclave, and I understand you can put the tray on the autoclaves.
Yes.
And obviously the base is just cold.
Well, the base has electronics. You cannot autoclave the base. You can wipe it down with a disinfectant, a surface disinfectant, but the trays are completely autoclavable multiple times.
Awesome, great. And another question is, do you work? I know you have a list of the dispenser gowns that you have that they will fit, and also compules and syringes. Is there any particular range that you know for sure that it won't fit, or any particular gun dispenser that it won't fit, that you've been, you have come to this issue in the past?
Well, I've I can
They
talk
change all
about
the time.
the compact, our Comax unit, that accepts virtually every composite compule. But I can't talk about everybody's dispenser gun that's on the market because there's so many, and it may be that some compules don't fit. But our Comax gun, which Amy is showing you in the picture, accepts every compule. And do you have a compule there, Amy, just to show how easy it is to load and unload? You know,
I
okay.
don't, but you just pull the plunger back and then you insert the compule and then you extrude the material just like that.
And then to get it out, you just pull back the flange and it just drops out. I know that on some of the compule dispensers, it's a little difficult to take out more so than put in.
Perfect. Excellent.
And one other thing, I'm sorry, but one other thing about our Comax, since we're talking about autoclave, our Comax dispenser gun is also completely autoclavable.
Good. Yeah, good. And what about a syringe or a compule himself to fit on the slots?
A syringe to fit, I'm not sure.
That it won't fit.
Oh, those. We have a 7-hole syringe. The multi-tray has 2 slots which hold some of the syringes. The 7-hole syringe tray holds more different sizes, and there's no standardization in dentistry. This is part of the problem. I see Jason Smithson's coming on. There's no standardization. So you have compules that are different sizes. You have syringes that are definitely different sizes. And so if you have, I would call it a very fat syringe or something, it might not fit the multi-pro, and you'd have to use the 7-hole syringe tray if you want to use that particular syringe.
Fair enough. I mean, I understand the tray for all the syringes, it will fit all of them. However, I've seen people struggling on the caps with the multi-pro or the 3-tray, you know, back then, but we always work around to make it work. And just the last question for you guys before we move to with Jason is what is the, you know, as I say, you know, there's other brands of composite warmers. What will be the unique of Calset that it will put us apart?
Well, first of all, I would tell you, first of all, we've been making these things for 20 years. We were the first company to introduce heating to the dental industry. Secondly, you know, we're ISO certified. We take quality very seriously. And I have dentists, for example, I spoke with a dentist in Switzerland, Dr. Gerald, I don't know how to pronounce his name. Anyway, he says, I've been using mine for 15 years. It still works, you know. So that's going to be something that you have to appreciate when you're buying an Addent product. This the quality is built in. And although some other manufacturers have trays, they say they're anodized, but there's different types of anodizing. We go to the extreme of using a special anodizing that really is autoclavable. So those are some of the advantages. And then we're here to back you up. If there's a question, we'll help.
Oh, awesome. Hey, well, thank you. We just want to wrap it up there, and we're going to keep chatting now. Jason, Dr. Jason, would just join us out. But thank you so much, Josh and Malena.
Thank you. I just want to say hello to Dr. Smithson. How are you, Jason?
Hi, Josh. I'm actually wishing I tuned in earlier. That was very interesting.
Okay.
I was only here for the last few minutes, and it looked really good. So I should have been here a bit earlier, I think.
Well, we have a lot on our website. We have some videos, and I'm going to be giving a talk at the, I don't know if you heard of this Northern Lights meeting. It's run by Richard Price. It's a very highbrow sort of meeting where all of the researchers come, not dentists don't come to it, but researchers from all the different manufacturers. And I'm hoping not making a mistake, but I'm giving a lecture at that meeting discussing some of the, I would say, controversies about heating. There are some people that have doubts about it, and I want to try to dispel some of that. So anyway,
George,
I'll have that available, so I'll send that to you once it's finished. Okay.
Yeah, that would be great.
Still working on it. Yeah.
just out of curiosity, where is this Northern Light meetings?
It's in Toronto this year. It's in Canada usually. Dr. Richard Price is the professor at the university, and 2 years ago it was in Nova Scotia. This year it's in. You got to be invited. It's one of these special deals. And most of the people that come are researchers. There are a lot of people from Brazil, because we do a lot of research, done a lot of dental materials research is done in Brazil, but all of the manufacturers are there with their research chemists and that sort of thing.
Right,
So that's
fair enough.
It is.
Anyway, cool. Thank you for that. Now we'll just do a quick introduction to Dr. Jason Smithson, who is joining us all the way from the UK, somewhere
From my kitchen.
somewhere around there, from your kitchen. So you finished dinner, or cooking dinner?
Just about. Roast beef.
Roast beef. Wow, that's nice. Well,
British.
welcome to join us to the coldness. Well, it's getting warmer in New Zealand, very wet New Zealand, which I believe you were here. Was it 2019? Jason, you were here?
I've actually been there more recently. I was in New Zealand last year in Auckland.
All right. Okay.
Well, you missed me. I saw Mark.
Oh, did you? Oh, cool.
Yeah. I saw Mark, so that was good.
He didn't. People. That's
fine. He didn't take me out for drinking, so that was fortunate for my liver.
Oh, I was gonna say, because you never survive in the industry. I shouldn't say.
No, I know.
I should say this when we're recording, but in the industry here in New Zealand, he's well known as the roadie guy. He always go for a roadie. So if you see him when he's out, you always say you can't be the last one. You just cannot be the last one.
Last time I nearly had to go to hospital after him.
Right. Well, welcome back to New Zealand then, virtually. Hopefully you had a good time last time you were here. But I think when I saw you last, you were doing was the symposium. I can't remember. It was a 2-day thing or a 1-day thing. I can't remember. You were
2 days. Yeah.
Yeah, it was just before the pandemic, I believe. Yeah.
Yeah. In Auckland.
Cool. Well, I think Dr. Jason Smithson doesn't need an introduction. He's one of celebs in the dental industry, been involved with many different good companies, from the GCs, 3Ms, the Cosmo, Dent, the Addent, and et cetera, based in there. I believe you're still practicing as a dentist, Jason?
I hope so. I've got 2 young children, so that's not going to change anytime soon. I got college to pay for.
Oh, fair enough. Yeah, I thought in the UK it was slightly affordable, but never mind.
Yeah, a little bit more so, but you didn't meet my children, so.
Fair enough. Hey, well, thank you for joining us. Look, we're just having a really quick chat, an informal chat. And this is a platform that we developed over COVID, and we providing, when all the infection control things was happening, and we keep going and we invite partners to talk about products and, things that we're promoting, et cetera. And I was just telling Malena and Josh that for some reason, the last 2 weeks, I don't know who's been talking about it, but they've been very popular, the Calset, the Calset range. So even though we planned this months before, it was like a right time to come in because it's been on the hip. So thank you for joining us. And as Dr. said before, so we're just having a quick chat with a Q&A and a few uses of the composite heater that I didn't know. I'm sure some people did know, but when I say I didn't know, is some dentists asked me, thinking that I would know, and I didn't know about the cement or how do you place the veneers and the onlays, for example. So that's good. But my first question for you, Jason, is like, when did you start using the composite heaters?
It's been like, gosh, I want to say 50, it might be 12, but about 15 years, well over 10 years, let's say that.
Okay.
So a long time. So, and yes, I use it in my office, well, daily, if not 3 or 4 times a day. So okay. Yeah, I've got a relatively high level of experience with resin heaters. And the other thing is I've been in the same office since now I feel old, 1998, in a small town with not a particularly transient population. So I've been seeing the same patients since 1998, and now you know, the little kids who I saw when they were born and now coming back with their kids. So the interesting thing is I'm able to, I've kind of got my own long-term perspective follow-ups of things. So I understand what works and what doesn't. And actually, you know, sometimes some of the things you read in the research that suggests things will work or won't work, actually, when you follow them yourself, you actually see that sometimes the research is wrong, or perhaps. Actually, I saw a very interesting lecture at the British Orthodontic Society 3 weeks ago, and by an American speaker, I forget his name, but he was saying that oftentimes academic research is quite a way behind the experience level of a higher end general practitioner, and really we're pushing the boundaries. So yeah, that's kind of where I'm at with the heating.
If you
works, let's say that.
One of the very few complaints, and Josh was saying that, you know, that they built to last, and as a salesperson, you know, if you make them last, you know, 5 years, it will be better for us. But actually, they do last. You know, they're just very well built, and the ones that we resell to the same people is because they dropped it, they lost it. The one person put it on the autoclave, you know, the things like that. But for users, you know, they do last, right? But my question was, you know, you've been using it for 10 years. Have you, what is that you use it the most? Or, I mean, I know it's a composite heater, but is it every single composite you use it for? Have you found new ways to use it? You know, like this guy, Josh was talking about the veneers cement, or what is the most common? There's some dentists out here that they buy it, they use it thinking they're gonna turn a packable composite into flowable, and obviously that doesn't happen, and then they just kind of like use it on and off. And my understanding is that you should be using for everything.
I don't use it exactly for everything, but I use it at least 50% of the time. I think you kind of alluded to it at one point there. I use it when you want the physical properties and actually the aesthetic properties of a flowable. You want the physical and the aesthetic properties of a packable composite, but you want the kind of workability, if you will, of a flowable. So I might use it, for example, if I want to use a packable composite in a very narrow class 2 box, and it can be quite difficult to get flowable in there without causing voids. There are some caveats to that in terms of how you might like cure it. I also use it, I do a lot of onlays, and I've been doing posterior onlays with lithium disilicate for, 20 years or so now. And I find the best outcome with onlays in terms of cementation is with heated composite. And the reason for that is, firstly, from a very practical point of view, once you place the heated composite, it's actually very, very simple to clean up. A lot of the veneer cements are great in terms of seating ability, because you get a very thin film thickness, but actually they're very challenging to clean up. Whereas with heated composite, it will just peel off with an Explorer. It's just a dream. The other advantage of using heated composite for an onlay is, particularly on the upper arch, on the maxillary arch, if you finish in the mid-facial or mid-buccal, whatever you want to call it, oftentimes you'll get a line where the transition is between the onlay, the ceramic, and the tooth. Now, with most veneer cements are typically a little bit more translucent than regular composite. And because of that, you will often get a little tiny gray line where the ceramic meets the tooth if you use a veneer cement. If I use, for example, the correct Vita shade packable composite, so I might use A1, A2, A3, A4, whatever, and heat it, it hides the margin amazingly. So you can hide the margin on an upper first premolar, upper second premolar, even an upper first molar beautifully, and make it invisible with the heated composite. The other thing is, obviously, I've been reviewing these cases for a long time now, and what I see specifically with the heated composite cases in comparison to the veneer cement cases is that you don't get ditching over time, because obviously if that's in the mid-facial, that margin's in the mid-facial, it's subject to fairly aggressive toothbrushing movements. And yeah, not over the first 12, 18 months, it doesn't make much difference. But when you review them over 5 or 10 years, maybe 15 years, you start to see a loss of the composite resin at the margin, particularly with the veneer cements, because that's the weakest thing. Obviously, the ceramic and the tooth are a little bit more toothbrush abrasion resistant, if you will, than the veneer cement. You don't tend to see that so much with the heated composite. I probably used it for less time with veneers. And the reason for that really is because historically I was using feldspathic veneers, stacked veneers, and very, very thin feldspathic veneers. If you use heated composite, because of the pressure you have to apply to seat the veneers with the heated composite, you might crack them. But nowadays, I've switched over pretty much universally to lithium disilicate. So even with thin lithium disilicate veneers, 0.3, 0.5, which is super thin, I've never cracked one with heated resin. So I've got a reasonable follow-up with veneers now. And actually, the advantages with the veneers are exactly the same as the onlays. The other thing I use it for is, a lot of people do, for example, periosplints, particularly on the lower lingual. And one of the things some people do is they use fiber, for example, Ribond would be a good example. I use that fairly commonly for that application. And it's really challenging to get the Ribond and the flowable composite into position because the Ribond tends to pull back. So what I do is I take an impression of the lingual before I start with a clear EBS material, something like RSVP by Cosmodent. I don't know if you carry that, or Exoclear by GC, Memisil by Kulza, something like that. They would all work. And then you place your Ribond and put a little bit of the bonding agent or a little bit of liquid resin on it just to hold it in place. And then what I do is I place heated composite onto the stent and seat that over lingually, and then light cure it. And because it's heated, you can just do it in little tiny blobs, if you will, and then seat it, and it will flow. And then you get really, really nice coverage of your Ribond with the heated resin. And that's really robust, and it stands up over time. If you get, sometimes you get a little tiny defect, we can just infill with a little bit of heated composite, or perhaps even a little bit flowable. But that's another application I use it for. So yeah, I use it a lot, basically.
I can tell that. Well, you mentioned, having the principles and the aesthetics of a compable, but with a more manageable as a flow. We noticed in the last 2 years, I would say, or 3 years, the amount of people that I've seen, clients of mine, that they moved from a compable composite to a flowable composite has massively increased. So question number one is, will you heat a flowable composite? And if you do, the set temperature, what would that be? Like, is this because dentists are afraid to fail, or what is it? people moving into, this is a completely different topic, but I was just thought we were in the same
No,
question.
no, it's reasonable, and something I'm asked quite a lot in my classes is, would you heat a flowable? And my answer is, well, why would you do that? Because you have a flowable that has relatively low viscosity, which is what you're looking for. But it has the most flowables, not all, most flowables have the negative of higher translucency, typically, with the exception of the flowable opaques, which I'm sure you're aware of, particularly with the Cosmonet range. And they also have typically less favorable mechanical properties. So if you want something flowable, then my go-to is either to use a flowable, but accept the disadvantages that you've got there, or to heat a packable composite, and then I get flowable manipulation advantages, but I also get packable aesthetic advantages and also mechanical advantages. So another reason why I might heat a packable, actually, I forgot to mention it when I was rambling on in the beginning, is also on the facial surface when I'm doing resin veneers. If you use, for example, a brush and a modeling resin, which I do typically, if you heat the resin, you're gonna get much better. I don't know if it's even a word, adaptability, let's say, with your packable resin, and it's also gonna polish better and have better mechanical properties in the end. So that's where I am on that. So my answer to your question in the long run is no. I wouldn't heat a flowable.
Yeah, fair enough. That's good. Now, the other question I have about that is about, I'm sure you've been, I actually don't know if other brands of composite or other brands of calcets will go higher, other brands of composite heater, will go higher on temperature than what calcet does. I do understand that some composites have a limit of temperatures you can go. However, and I'm not generalize all dentists, but some dentists in New Zealand, they tend not to read the instructions and they want as hard as they can.
Well, so, I'm guilty of that as well sometimes, so I can't criticize that. Not always, but sometimes.
So is this a limit that we can hit on composites? Do we need to go?
Can I try to answer that?
Please do, Josh. Yeah.
This happened almost 20 years ago. We were making a calcet heater that was a lower temperature. I think it was 54 degrees C. And we got a call from the University of Oregon, Dr. Jack Farrakhan and Dr. Tom Hilton, and they said, "Can you raise the temperature of the calcet?" And I said, "Well, what temperature do you want to raise it to?" I said, how are you currently heating? He says, "We're putting it in a little baggie and putting it in boiling water." And they said, "Can you raise the temperature of the calcet to 100 degrees C?" And I said, "Well, I could do it, but I don't think it's something I want to do because there's a potential damage to the pulp." So it was a negotiated number. The 68 degrees C didn't come about from science. It just came about because we made the first units for the University of Oregon with 68, and everybody in the industry has used that number. So to answer the question, we probably need some more research, both from a safety point of view and from a materials point of view, to see if a higher number would give us some improvements.
Fair enough. There you go.
I think the other thing you need to look at actually is, and Josh may or may not agree with me on this, probably I think he may agree with me, is the actual product. Because what one of the reasons why I'm so sold on the Calset is a lot of heating products are basically a heating pad. It's give or take an electric kettle element, give or take, with a pad on top, and you put the composite on the pad and you scoop it off and take it to the tooth. Now, as Josh will probably have told you, that the cooling curve of the composite is super steep. So by the time you get it to the tooth, It's barely heated. Now, the cool thing about the Calset is, firstly, you're putting the compule gun into the heater. So you're pulling that out and taking it straight to the tooth. Now, the composite is actually insulated by the plastic of the compule, which is also heated. So it's losing heat at a much slower rate than if you just scooped it straight off the flat. The other cool thing, which actually Josh didn't mention in his final question, which is one of the unique things about the Calset, which I like, is the fact you can heat the instruments. So you're actually, which is very unusual, you're actually sculpting the composite resin with a heated instrument. So therefore, you're not, if you imagine if you're sculpting it with a cold room temperature instrument, you're losing heat via conduction, which you're not so much with this bit of kit. So really, when you're talking about temperatures, you've got to compare apples with apples, and you've got to compare similar heaters, really, because one of the heaters where you've just got a flat pad is not going to be the same deal as this. You could probably get away, in my opinion, and Josh can chime in, I guess, you could probably get away with heating the resin less with this in comparison with a flat plate heater, because you're going to lose a lot less via conduction and convection. I don't know if you're going to input on that, Josh.
Well, I completely agree. The idea is 90% of the studies that have been done in what's called an isothermal situation. It's done in a laboratory. And so there's lots of factors. Bringing it to the tooth is one factor. The tooth itself conducts heat away. So there's a conductive element. And to be honest with you, we're going to be introducing a heated dispenser gun next month, which will bring the actual temperature right to the tooth. So that's kind of like the ultimate progression. Of course, it's more expensive, but it replaces two products. It replaces the dispenser gun and the heating device. So in that sense, and some of the new research, they're trying to create a model of what the tooth is like. But even if they measure the temperature of their mold or whatever it is, let's say it's measured tooth temperature, doesn't have the same conductive properties as an actual tooth. So these are some of the things I'm going to be discussing at this meeting I mentioned earlier to try to get to the next level. And it includes temperatures. For example, it may be possible to have a higher temperature setting, which would result in, just with the current situation, result in a higher temperature at the tooth surface, and might still be okay from a safety point of view. But these are things that we still don't know the answers to.
I think there was some research by Mayor. I don't know if you're aware of this. The guy is MJOR with the little thingy above the O. I forget what that's called. This was way back. I did this in my master's program, and they talk about residual dentine thickness, which is the thickness of dentine between the pulp and the burr, essentially. And they were talking, it was relatively crudely measured at that point, but they were saying, off the top of my head, and I'm guessing now, but it was something like about 1.5 millimeters of RDT made very little difference in terms of frying the pulp. So that wasn't a major consideration. But then again, I guess if you're in a cavity, you don't have the luxury of being able to measure the RDT unless by sectioning the tooth. So you kind of don't know.
But they have done studies where they put thermocouples in the teeth to see what the temperatures are that take place in the different process of restoration, including the temperature that the composite reaches once it gets to the tooth. And of course, it drops substantially, as you mentioned. But the other aspect of safety is something that we should keep in mind. When we polymerize these composites, the temperatures, the exothermic temperature of the polymerization reaction is so much higher. And there's been studies to show that. And if you want to go higher than that, you can look at one or two studies on the actual use of a high-speed drill and what happens to the temperature there. They don't do these studies anymore because they don't want to kill people and fry their pulps. But the last study that was done was like 50 years ago on monkeys, and they found some interesting information about what happens to the pulp there when you drill a tooth, and it's not pleasant. There's really high temperatures. So the highest temperature is generated by the drilling process. The next highest temperature is generated by the curing process, and the least temperature in the tooth or to the pulp is generated by the heating of the material.
From my own very not scientific anecdotal experience, I haven't noticed any particular increase in endo rates on, for example, onlays, which would be the deeper restorations I do in comparison to veneers, in onlays that are fitted with heated resin versus onlays fitted with regular veneer cement. So I'm, you know, if that was happening all over the place over the last 10 or 15 years, I would have noticed.
Sure.
Yeah.
Obviously, the heat. There is some people complaining about the heat on that they can feel for certain curing lights. You know that it gets
Right.
very hot.
You put a curing light on your thumb and see what that feels like, especially the high. Yeah.
And but I can't remember anybody, including myself, with my dentist heating composite and feeling, you know, I can't see. I don't know, it's because I'm already numb, but I'm already numb when they're curing it. So yeah, I will imagine in my non-scientific mind, it will be a lot harder a curing light than a composite, you know, a heated composite, you know. But anyway, that was me. That was my input, my low input. But anyway, hey, look, we're coming to our end, and hopefully some of the dentists will go back to work, and Jason will have to go back to the roast beef that started on Tuesday night.
Wine now.
Yeah, also roast wine.
No, just wine.
But look, I just want to say a huge thank you, you know, from Malena to organize these. You know, we talk about this over IDS in March, and here we are in end of October, finally making it happen. But I think it was a great time. It's a good timing. We got the new, you know, catalog of calcets with a multi-pro as a future, and the new tray, the restoration tray, that, as Josh mentioned, you can put it on lace as well because it's deeper than the veneers. So it was all good timing, you know, and thank you so much, Jason, for joining us. Taking half an hour of
as a little aside, even if you're not heating the resin and you're using a regular veneer cement, that veneer tray is actually quite useful. It saves you spreading the things all over your tray table. So it's quite a neat bit of kit, full stop. So there we go.
Yeah, and you know, this is out of many tools that dentists use in a practice, and I'm always amazed all the things that dentists use to just do, you know, a tiny bit, you know, in the mouth. But this is a tool that I've been selling this for nearly 9 years. Next month's going to be 9 years. And the feedback is just the things that you get out of these compared to the things you get out of many other things. You know, a laser is 10 grand, you know, compared to this that is under 2 grand. You know, it's the cost effective and the benefits of this is just nearly none. So I'm very, very advised. It's one of the things I always wonder if I'm a dentist, will I get this now or will I get this? Yes, definitely a yes. But anyway, thank you so much for the input. Nice to meet you, Josh. Nice to see you, Malena.
Nice to see you again. It's a pleasure.
And hopefully, yeah, we'll do that in one of the meetings, hopefully in the future. And for everybody else, we'll have this recording ready for next week. We're gonna do a deal coming up on an EDM. So yeah, watch out. So happy Friday for those who's in New Zealand, and happy evening Thursday for Jason, and afternoon for Malena and Josh. Yeah, but thank you so much.
Thank you, Rudy.
Thank you. And nice to see you again.
And thank you for talking about Jason. I really appreciate your comments.
Real pleasure. Yeah.
Thanks.
Thank you so much.
Like I said, I should have come in early.
All right, bye.